CDC saying flu activity has left tens of thousands of Americans hospitalized this season, with flu-related deaths also climbing. An estimated 3,100 people have died from the flu so far, including 5 pediatric patients this week. Officials are urging everyone ages 6 months and older who has not received a flu shot to get one. We're joined now by CNN medical correspondent Meg Terrell. Meg, break these numbers down for us. This is a very serious flu season we are looking at.
Yeah, Brianna, the numbers certainly are heating up really quickly. Right now, the latest update from the CDC, which was for the week that ended December 20th, so just before holiday travel for a lot of folks, it shows that 32 out of 40 jurisdictions have high or very high levels of flu activity right now. In terms of severity, the CDC actually says that severity indicators are currently low at the moment, but that flu activity is expected to continue for several weeks. And you can see the U.S. map right here. Those purple states are the ones that are seeing the highest flu activity, and then followed by the dark red. So states like New York, South Carolina, Louisiana, Colorado seeing the highest levels of activity. And of course, New York State just reported a few days ago that it recorded the highest number of flu cases that have been confirmed in that state on record, and they've been tracking this since 2004. Now, they noted that some of that is due to more tracking, but not all of it, and certainly shows that compared with even more recent years, this is a more severe flu season, at least in New York State. They had a 38% increase week over week in flu cases there, and a 68% or 63% increase in hospitalizations. Now, in terms of the overall U.S., the CDC estimates that so far this season, we've had at least 7.5 million illnesses with flu, 81,000 hospitalizations, and 3,100 deaths. They also reported 5 pediatric deaths in that week, which brings the total in the season to 8, which is just a tragic thing to hear. Now, you may have been hearing about a new subclade, a new sort of strain of flu that we are experiencing here in the United States, and we saw it in other countries as well. It's called subclade K, and it represents sort of a drift of the virus. The good news is, though, that experts say the flu vaccine should still provide protection against that strain of the virus. It is just a little bit of a drift from what the flu vaccines were designed to protect against, but they are still in place and out there for folks to get, Brianna.
So what are the recommendations if people think they may have the flu, Meg?
Yeah, so there are actually things you can do about the flu, which is a good thing. First of all, of course, we were just mentioning flu shots. Those are recommended as the best form of prevention, and it's still not too late to go out and get one if you haven't had one already. It takes maybe a week for the protection to start kicking in. They are the best form of prevention against severe disease. Flu and COVID combo home tests. Are now available, and this is something that surprises a lot of folks, but we all got used to testing ourselves at home for COVID over the last few years. Very similar tests are now available, which test you for flu A, flu B, and COVID-19. And antiviral drugs are available if you do test positive, particularly if you're in a high-risk group, if you're over 65, if you have other health conditions, if you're pregnant, or also for young children. It is recommended that you talk with a physician or a healthcare provider about an antiviral drug. There are multiple drugs available by prescription, so sometimes telemedicine can be a good way of doing that. They can shorten the duration of the illness, and they can also lessen symptoms. They are also available if you've been exposed, maybe a household member. You can get an antiviral drug, and that can help prevent you from getting the flu as well. So some options out there, Brianna, in addition to wash your hands, stay home, do all the things you do when you're sick to take care of yourself.